Hey guys, here we are. We're starting the respiratory system. In the last section, you just looked at the anatomy of the lungs, the nose, and basically just the respiratory system. So we didn't do notes for that. In this section of notes, we're going to be looking at both the upper and lower respiratory tracts. So let's go ahead and begin. In the upper respiratory tract, we're going to begin by looking at the nose, the pharynx, and the larynx. So really, if we're thinking about the upper respiratory tract, it's in the head. You can see we have sinuses, a nasal cavity, the hard palate, which is above your teeth. You can feel that with your tongue. We've got your tongue. Here's the oral cavity. The epiglottis, where the flap is that closes over the airway when you're swallowing so that food can go down the esophagus as opposed to into your trachea. And then we have the larynx, which is located about right here, which is your voice box. So let's dive a little more deeply into this. The nose opens at the nostrils or the nares and leads into the nasal cavities. Luckily, you have one, so you're familiar with this already. The main function of your nose, though, is to filter air and to warm and moisten it. And if you think about this, if you've ever been cleaning like in an old attic or working out with a lot of dirt or sawdust, when you go to blow your nose the next day, you'll actually see quite a lot of debris in there. And that's all because that's been filtered by the hairs and the mucus in your nose. We also have odor detection with specialized cells in your nasal cavity. And then the tear glands drain into this cavity. This is what leads to a runny nose. It's also the reason why if you cry and produce a lot of tears, your nose will run as well, because that's draining into the nasal cavities. The pharynx is the funnel-shaped cavity. It's all commonly called the throat, and it has three basic portions based on the location. The nasopharynx is that opening behind the nose. The oropharynx is the opening behind the mouth. And then the laryngopharynx, which is where these two join together. On either side of the throat, you have tonsils, which provide a lymphatic defense during breathing. And if you'll recall, we talked about the tonsils when we were doing the immune system. And so this lymphatic defense here just helps with your immune response as you're breathing in air. It's also the junction of the oral cavity and the pharynx. Your larynx is a triangular cartilaginous structure, and it's in the middle of your throat. It passes air between the pharynx and the trachea, but it's also what houses your vocal cords or your voice box. The sound is produced by having two folds or your vocal cords, and you can use muscles to tighten or loosen those folds, allowing you to vibrate air across them. The glottis is the actual opening in the middle. So here we can look at this. Here we've got the vocal cords. Here they're relaxed. Here they've been tightened. The glottis is this opening between those folds. And you can see the base of your tongue back here. And you can see that epiglottis back in over here that can flip over and close this up when we swallow. So it's the vibration of air across these folds and the dependence of how tight those folds are that allows us to make the different sounds. Now, as we head down into the lower respiratory tract, you'll notice we've already done this upper tract, which is pretty much your head. And that entrance into the lower respiratory tract is where the voice box is, or the larynx. Now we're going to look at the trachea, which is this cartilaginous ring structure that's allowing air to get down to the lungs. The bronchi, bronchus is singular, where we see it branching out into each lung. The bronchioles, which is that tree of smaller branches. And then at the very end of those, we have the alveoli, or the air sacs. Altogether, that makes the lung. And then you can see the diaphragm at the base, which allows for respiration. So let's talk more specifically about each structure. The trachea itself is a tube. We sometimes refer to it as the windpipe, and it connects the larynx to the primary bronchi. It's made of connective tissue, smooth muscle, and then you can even feel, if you feel along in your throat, the cartilaginous rings. It's also lined with cilia and mucus that keep the lungs clean. So if you look at the trachea, you can see each individual cell has these little itty bitty teeny tiny cilia. There's some goblet cells here which help produce that mucus, and as particles or viruses or things that shouldn't be there come into the lungs, as they're headed down the trachea, they'll sometimes be trapped in this mucus, and then the cilia consistently beat this upwards, allowing you to get it out of the lungs. As a side note, nicotine paralyzes these cilia, which prevents your lungs from getting debris out of them. It's one of the reasons why smokers get such a gnarly cough, and it's also one of the reasons why smokers aren't as good athletically. The bronchial tree has two main branches. The bronchi is just the splitting of the trachea into the right and left side, and this carries air to each lung. The bronchioles are the smaller branches that branch off the bronchi. They're only about 1 millimeter in diameter. They have much, much thinner walls, and they carry the air out towards these sacs. And the end of each bronchiole has an alveoli, which is an elongated sac, looks a little bit like a balloon, and this is where the actual gas exchange occurs. So if we think about each lung, you have a right and a left lung, each one is made up of the bronchi, which is the first branch, the bronchioles, which are the smaller branches. They look a lot like tree branches, and the alveoli, which are those air sacs at the end. The lung itself is wrapped in a membranous sac called the pleura, and it's 2 layers thick, and it helps lubricate the lungs, and it helps with reducing friction as you inhale and exhale. When you think about the lobes of your lung, they're kind of in portions. The right lung has 3 lobes, and the left lung has 2 lobes because the heart is slightly off-centered and takes up the space that one of those lobes would take up. Notice this is different than in your pig. I believe pigs have 4 lobes and 3 lobes. So we are going to do that pig dissection, so be careful with that. But in humans, 3 lobes on the right side and 2 lobes on the left. And each lobe is divided into lobules, which are just smaller sections. So remember, we talked about gas exchange is at the alveoli. Those are those little tiny sacs at the end of each lung. There's about 300 million alveoli in the lungs, and they are designed to increase the surface area. Each one is surrounded by blood capillaries, which allow for gas exchange to occur. They're very, very thin capillaries, which just has a single layer of epithelium, so that gas can easily flow from the air sac, the alveoli, into the bloodstream. So oxygen's flowing into the bloodstream, and then carbon dioxide is diffusing back into the alveoli and then being exhaled. There is a hormone called surfactant, which is produced in the alveoli, and it actually works almost like stretching a balloon, and it allows them to stay open and be flexible enough to inflate. Newborn babies, that first breath is a humdinger. It requires a tremendous amount of muscle strength, but it also requires that presence of that surfactant to help loosen those alveoli. Premature babies are born so early, their lungs have not begun producing this surfactant, which is why frequently a premature baby has to be on a ventilator because they are just physically not strong enough to open those alveoli without the surfactant present. Sometimes you'll hear doctors testing a woman to see if it's okay for the baby to be born, and what they're testing for is that surfactant. Here's an image of the alveoli. You can see where you've got that little tiny bronchiole that is carrying the air out to these little outpouchings, or these alveoli, these little sacs. And each sac is lined with capillaries. And we can see that the red capillaries are leaving and heading back towards the heart. The blue ones are coming away from the heart. And these are high in carbon dioxide, low in oxygen. When the blood's delivered, they dump the carbon dioxide and pull in the oxygen, becoming oxygen rich. The carbon dioxide is now in the alveolar sac and can be exhaled. The oxygen has moved into the bloodstream, and as it moves back into the bloodstream, you can see it's being returned to the heart so that it can be pumped out to the body. All right, that's the upper and lower respiratory tract. Thank you, guys.